Telemedicine, the practice of caring for patients remotely when the provider and patient are not physically present with each other. With the outbreak of the coronavirus in late 2019, telemedicine has become a large part of the healthcare field. The use of telemedicine, or telehealth, has the advantage of social distance, promoting effective use of clinicians, improving the access to care, lowering cost of healthcare, and reducing health disparities. This is great for people who do not have great access to care, but is it helpful for the communication and relationship between the patient and the physician? This form of communication is dependent on if the patient and physician have the correct technology and understand how to use that form of communication. How effective these visits are also depend on the generation of people that are being reached. In the older population, knowing how to use emerging technology and not having age-related barriers inflict with their use of it makes having an electronic visit a difficult task. Along with the technology, there's also the self-evaluation at home. Without the help of another family member reading vitals on something like a blood pressure cuff, it could be difficult, even if they can get the cuff on by themselves. This then leads to older adults doing in-person visits, which defeats the purpose of the virtual meeting and keeping the most at-risk patients safe. Other generations are able to get past the technology barrier, but a relationship between the patient and physician is still not achieved, especially if the patient and the physician have never seen each other before. The patient-physician relationship also deals with the health self-efficacy of the patient. If the patient believes that they can control the symptoms by themselves at home, they are going to enjoy the telemedicine approach to healthcare. If someone feels as if they are not capable of healing themselves, they are not going to like the telemedicine approach because they feel as if they are not receiving the same quality of care. There are other factors that affect the relationship of the patient and physician that they have no control over that are large factors in the telemedicine experience. One of these barriers is states that are not part of the continental United States. Some of these places are already in healthcare deserts to start off with, and healthcare is hard to come by, making telemedicine a logical solution. There are some problems, though, that lie with the telemedicine in these states. Depending on where the patient is located, the telemedicine physician who they are meeting with has probably never met this patient before. This could mean that the physician also does not have access to the medical records of the patient, so they have no clue what is going on in the patient's life. The lack of medical records could also be that the patient has never been to a physician or that the system that the physicians are using are not communicating. This can make the visit feel impersonal since they do not have an already established relationship. Things like cultural differences and English language dialects can also have a big part in the relationship between the patient and the physician. As long as physicians are open-minded and listen to what their patients have to say, the cultural barrier can be diminished, but the language barrier still remains. Not everything about telemedicine is bad, though, especially since video calling is way more popular than it was when telemedicine originated in the United States. Video calling allows physicians to see facial expressions and other nonverbals that can be crucial when the patient is not telling the physician everything. Dr. David Fleming also says that it is easier to have a trusting and warm relationship when patients are on a video conference versus just over the phone. Although it is not as good as an in-person visit and is hard to diagnose any serious illnesses, it does make routine checkups and well visits easier, whilst keeping everyone safe. So, let's look at an example. Susan is a working single mother who gets an hour lunch break, but cannot make it to doctors and back in that amount of time. On her weekends, her 2 boys have soccer games and cross-country meets, making her Saturday full as well. Her physician, who she has gone to for many years, has just recently introduced telemedicine into their practice. Since her and her physician already have an established relationship, this doctor visit can be done on her lunch break without her leaving work or giving up going to her children's games on the weekend. All in all, telemedicine can be positive, and the physician-patient relationship doesn't have to be compromised with the virtual healthcare experience. All it takes is the right technology and an open mind to get through these hard times.